Hey, it's Dr. Birchler. I had a patient come into my office yesterday. In this case, you know, female, maybe 50, 60 years old or so. And she is having pain down into her right leg, starting at the buttock and then going down into the foot and having trouble walking. And when I inquired about what's going on and did some testing of her leg and muscles, her muscles are weak in her feet and toes. She's not able to um, get proper force, elevate the toes properly, grip the toes properly, um, and that's a sign of what would be called a disc herniation. Now, most people think that if they have leg pain or pain radiating down their leg, like they have a disc bulge and they need surgery. I think a lot of people almost assume that. And the fact is, from the best available science and reviews on this, out of people who have radiating leg pain, probably only 2 to 4% of those people actually need surgery. The huge proportion of people can be treated and helped non-surgically in a case like that. That being said, what I showed here is an example of an MRI showing a disc herniation, the type that could affect the nerves coming out of the lower back and cause leg pain. And a lot of people would assume, well, if you actually have a disc herniation, you need surgery because you have a disc herniation. But there have been review studies where they actually take people that they know have disc herniations and randomize them to treatment, in this case, chiropractic care preceding surgery. And the question is really, well, if you didn't do surgery, what would happen? And would they get better? Would they be able to get help? And what they found is 60% of people, even with known for sure disc herniations causing that leg pain, 60% of them will be able to get better in a few months of time with chiropractic care without any of the risks of surgery. What are the risks of surgery? Well, just with a normal microdiscectomy from a bulged disc, it's 1 in 1,000 risk of death just from that surgery. And that's not saying anything bad against the surgeons. It's amazing what can be done when it needs to be done, but just inherent in the nature of cutting things open and anesthetics and all that kind of stuff. There's some risk there. And it's about 1 in 1,000. Well, I have 4 kids. I don't want 1 in 1,000 risk of dying. I would rather do something else. Another statistic on that is people who have a disc herniation, just the average time of continuous pain that they have till resolution is over a year. And that's average. So some people, they have continuous unrelenting pain for a couple of years or so with a disc herniation. So it's stuff that, and I've never had this, but I've seen a couple thousand patients with these kind of things, and it can be horrible pain and a helpless feeling. So this is something that people really need. They want to get better like now. They're hurting, they're in severe pain, and they need to be taken care of. And chiropractic can often start to change things for them within a matter of days to weeks, to the point where they go, like, I think I can deal with this without surgery. And then you keep working with it a few months of time. Based on the studies, about 80% of people report good or excellent results in pain relief within about 3 or 4 months or so of chiropractic care with a disc herniation. About 75% of people report a very marked, like dramatic pain relief within a few months of time with chiropractic care. So this is suffice to say, if you're out there and you're dealing with what you think is a disc herniation, maybe you know you have a disc herniation. If you have radiating leg pain, the percentages are overwhelming that you would be able to get help without surgery. I would not start by going to an orthopedist or somebody in that case. I would start by going to a chiropractor who's comfortable dealing with these things. If you need to get an MRI ordered, that can be done, but no need to go to the surgical thing first. Go to a chiropractor first, and then you could be directed, depending on your response or exam, if you need to have MRI or if you need to have a surgical consult sooner rather than later, or whether it makes sense just to get going and try to get you better before going into the higher risk types of procedures, in this case back surgery. Right? I hope this helps.